Late Night Health continues. I'm Mark Allen. Our guest, Eric Presser. He is, get this, he is the premier, he's the attending thoracic surgeon at Premier Surgical Associates in Palm Springs, and is an associate professor at the UC Riverside School of Medicine. I didn't even know they had a medical school at Riverside. I knew that they had an insect department, but I did not know about their School of Medicine. Yeah. And by the way, their insect department is one of the finest in the country. Just throwing that out, I don't know why I know that. Doctor, we're talking about lung cancer. Can we prevent lung cancer?
I'm glad you asked. Since I've been giving my lectures for 10 years now, we've made great strides in trying to prevent lung cancer, meaning that we finally came up with a screening process for high-risk smokers, actually. So according to the Center for Medicare and Medicaid Services, also known as CMS, back in February 2015, if you are between the ages of 55 and 77, you're asymptomatic, you smoked a pack of cigarettes for 30 years or 2 packs of cigarettes for 15 years, and you're a current smoker or stopped within the last 15 years, you are now considered a high-risk patient for getting lung cancer. What that means is the recommendation is a low-dose CAT scan of the chest to try to find these tumors before it becomes too late. The problem with lung cancer is by the time you're symptomatic, in most cases, the cancer has already spread and you are in the later stages, which means that your treatment options are very limited.
Stage 3 or stage 4?
Exactly, usually about stage 3 or stage 4. But if we can find these tumors earlier, then we can actually resect for cure in patients that are surgical candidates. And as a minimally invasive chest surgeon, I can't tell you how excited I've been over the last 3 years or so, because this has really come to light where a lot of people were afraid that these CAT scans were going to lead to overdiagnosis. But what I tell them is that in the proper hands, or if you actually sit down with the patient and go through all of the options with them, they will walk out of your office and understand exactly what the best option is to obtain a diagnosis. Everyone knows what a biopsy is. A biopsy is a sampling of tissue. And nowadays, with all of the technology and techniques we have of sampling tissue, obviously some are better than others.
I had a story, and we only have a couple minutes left. My mother in the 80s was a big smoker, and at least 2 packs a day. And she didn't stop until the 90s when she went into a semi-coma and was in ICU for 2.5, 3 months. And after that, she stopped. But she had a spot on a lung. They went in to biopsy it and remove it. They didn't know what it was. It turned out to be benign. But 3 days later, she's begging for a smoke.
Right.
That's frightening stuff.
It is frightening, and most of the time my patients are scared straight, if you will, which means that stopping to smoke cold turkey is possible, but at the same time, as we already discussed, the addictive qualities of nicotine mixed in with an oral fixation is very difficult to overcome. Many people, they want to live. They want to do what's right, but it's just so difficult. But at least we can try to find these tumors earlier nowadays and at least try to give people different options that they never had in the past. That's why fighting lung cancer is so exciting. And all of the properties that I discuss in my book, they not only apply to lung cancer, but they also apply to other cancers that are out there.
And we know that the cancer is on the rise because of the chemicals, because of our lifestyles. We look forward to your book, An Empowering Guide to Lung Cancer by Dr. Eric Presser. And we look forward to talking to you again on Late Night Health again soon. There's so many other topics to discuss. Secondhand smoke would be one, but we are out of time. If you want information, go to Amazon.com or go to latenighthealth.com. We'll have a pretty picture of Dr. Presser up there. There'll be a little bio and some information about him, as well as a link to his website or Amazon. I'm Mark Allen. Late Night Health continues, and we're going to be talking about coloring. So get your crayons ready, the clean kind, and we will be back in just a couple of moments here on Late Night Health.
If you're listening to Late Night Health right now, you're part of the growing target of baby boomers we're serving. Hi, I'm Daryl Wayne, producer of Late Night Health, inviting you to join the Late Night Health family. If you have any business targeting the growing boomer market, Late Night Health is the ideal advertising vehicle for you. From vitamins to insurance, alternative health to Western-style medicine, Late Night Health caters to the growing population of those over 40 years old. This vibrant demographic has expendable income to fight aging, purchase travel, take care of aging parents, or just have fun. Find out about the advertising opportunities with Late Night Health. Call us at 805-391-0308. That's 805-391-0308, or email us at info@latenighthealth.com. That's info@latenighthealth.com. Join Late Night Health as we empower people to take charge of their own health care. Call now at 805-391-0308. That's 805-391-0308.